sure it's got a good temperature. And then we can check the mobility in the turgor, make sure it has a normal speed of rise and fall. And then we would look for any lesions on the body, and if we found any, just palpate those and document them. The nails real quick, and we would also check the toenails as well. So we're just going to note the color of the nails, make sure they have good color, that they're not cyanotic. Go ahead and press and check for a capillary refill that they're good. We would also look for any lesions, any lines, or anything or pitting in the nails. And also we would check the clubbing, look at the proximal nail fold of the nail plate, and make sure that it's less than 180 degrees. So first we're just going to do the hair. We're just going to look at the distribution of the hair, the texture and the pattern, just to make sure that there's nothing going on that's too dry or brittle or something like that. So then we're going to move on to the scalp. We'll look in the scalp, make sure there's no scaliness, look for any hidden lesions or any moles that could be of concern in the scalp. Then we'll go ahead and palpate the skull, feel the contours of the head, make sure that it's symmetric. Look for the suture lines, occipital, and then the parietal suture lines. Make sure that they feel good. And then we're going to look at the face. Get your hair out of the way. Look at the face. Go ahead and palpate the face. Notice any facial expressions that she may make in case there's any soreness that she doesn't tell me about. Also, make sure the face is symmetric. Check for any edema or masses that she may have. Okay. So we're off. Okay, now we're going to look at your eyebrows. Make sure that they have good quality and quantity and distribution. Look for any scaliness or any underlying lesions that could be there. So we'll move on to take a look at the conjunctiva. Pull your eyes down like this. Note the color, the vascularization of the conjunctiva. Then use both fingers. Open her eyes wide. Have the patient look up, down, left, and right to check out the sclera, make sure it's a good color. So we're going to palpate your sinuses real quick. So first we'll start with the frontal sinus. And note if there's any tenderness in those sinuses, or if we feel any crackling or anything like that. Feels good. Or if they're really tender. So first we're going to do preauricular, then postauricular, and then occipital. Check temporal, or not temporal, I'm sorry, tonsillar. Then we'll do submandibular. Then we'll do submental. The superficial clavicle. No, superficial cervical. The posterior, superficial cervical, posterior cervical, and then the deep cervical, and then the supraclavicular cartilage, and then feel the cricoid right under that, just to make sure that the thyroid is aligned and the trachea is aligned in the middle. We're just going to note the width between her her muscle and her neck, the sternocleidomastoid. Just make sure it's the same width and that it's aligned.
To assess his orbital area, noting that his eyebrows are nice and full and they extend all the way to the temporal canthus, and there's no crusting or swelling present. Is there any pain or tenderness noted?
No.
All right. And then we want to inspect and palpate his orbital area, noting any pain or tenderness. Is there any?
No.
All right, there's no edema. Inspecting and palpating for any lesions, nodules, or edema. Is there any pain or tenderness present?
No.
All right, we want to draw an imaginary line from the inner canthus of the eye, ensuring that the auricle is at or above, noting that the patient has normal placement of the ears on the head. The next thing that we want to inspect and palpate, ensuring that the color is the same color as the rest of his face, that there's no swelling, lesions, or masses. His cartilage, there's no deviation, it's midline. Is there any pain or tenderness in the nose?
No.
All right. We also want to check for the patency of the nares by occluding one, having the patient breathe in and out and let us know if there's any difficulty breathing. No?
No.
All right, great. The next test that we were going to perform patient's frontal and maxillary sinuses. We're going to palpate below the bony brow for the frontal sinuses. Is there any pain or tenderness?
No.
All right, note that there's no swelling also. All right, and his maxillary sinuses, we want to palpate below the zygomatic process, noting any pain or tenderness or swelling. Is there any pain or tenderness?
No.
All right, great. The next thing we want to do is we want to, there's no abnormal findings within his teeth, no, all right, and we want to pull his lips back and look at the gingiva to note that it's moist and pink with no ulcerations, no lesions present, no redness or edema. All right, if you could please stick your tongue out for me and move your tongue side to side. This helps to test cranial nerves number 12, and it is intact. If you could please stick your tongue out for me. We want to go on ahead and view the tonsils and the posterior wall of the pharynx, noting that it's pink, smooth, and glistening. All right, and the tonsils are a +1. If you could please say ah. All right, and then
Tell me if you feel any pain. Any pain at all?
Nope.
Good. I'm looking for lumps and bumps, but everything feels fine right now. Okay. Next, I'm going to look at your face. Nice and symmetrical as well. I'm going to palpate your face. Any pain?
Nope.
Tenderness?
Nope.
No? Okay. I'm going to palpate your sinuses. You have to tell me if this is painful.
Nope.
Any pressure?
No pressure.
Okay. Any pressure?
Nope.
Maurice? Excellent. Now what I'm going to do is I'm going to have you clench your jaw, open it wide, and close it. Excellent. Now I'm going to auscultate your temporal arteries. Okay. Next, we're going to be giving I'm going to then palpate your neck. Make sure it's symmetrical. Right. I'm going to come on around to the back side. I'm going to feel your thyroid gland. Sit up straight.
Okay.
And swallow for me. Great. Any pain with that swallow?
Nope.
Okay, good. I'm going to see you swallow again. Good. Okay. Shrug your shoulders for me. Good. And down. Again, quicker. Down. Good. Now I'm going to test for lymph nodes and assess for them. You can just keep your head still. Okay. All right. Can you tell me in a full sentence what color that? Put your head to the right. I'm going to look for your jugular vein distension. Great. And then now lean to your left. I'm going to palpate your PMI. Okay, we're all done. Thank you.
I'm going to feel for the temporal pulse +2 bilaterally. I'm going to check the sinuses, the frontal sinuses, the maxillary. Do you feel any tenderness in either side?
No.
No? Eyebrow distribution is even. Eyelashes are even. I'm going to look at the ears. I'm going to press on the tragus, on the pinna, and then check the mastoid process. Ears are symmetrical. No discharge. Can you move your mouth side to side? Okay. I'm also going to look inside your mouth. Can you open your mouth for me? Alright, lips are pink and moist, as well as the gums and the buccal mucosa. Soft palate is moist. Tongue is pink. Can you open your mouth? Or lymph nodes. Preauricular, postauricular, occipital, submental, submandibular, tonsillar, superficial cervical, the deep cervical chain, the posterior cervical, and the supraclavicular. Lymph nodes are not palpable.
So first again, we're going to feel the thyroid cartilage. Move down to the cricoid. I'm going to ask the patient to take a sip of water and swallow so I can feel the rise and the fall of the isthmus under the pads of my index fingers. So now I'm just going to move over your trachea, and this is going to tell me if I can feel the gland of the thyroid on that side. We can feel it on